Can knee hugs help with back pain? Partly it depends on whether the back pain you're feeling is coming from the muscles that run up and down your spine. We have muscles that run beside our spine, along the back of us, from the tailbone all the way up to our head. And so if you imagine this is your back, this is your front, when you bend forwards, what they're doing is they're stretching while working, which is a really complicated thing to do. Luckily, we don't have to think about that very much. Our body does it all for us. But what the knee hug does is it stretches those muscles out without them working, and also moves all the joints in your back in a passive way, so that the body gets used to these different sensations, and that can sometimes allow the pain that you're feeling to die down a little bit. So what you do is you get your knee, and as the name says, you hug your knee a little bit, so you're pulling your knee up towards your chest. And depending on how flexible you are, the shape of your body, that will be easier or harder for you. So when you do this, you put your knee towards you, what you're hoping to do is feel the muscles along here, feel a stretch happening in there, and then when you feel that stretch, you sit there with your knee and you try and get that stretch or that tension to release slightly, and then you do it a little bit more. You can do it with one knee or the other knee, and you can explore the difference between whether one feels easy or hard. If it's slightly harder, you might want to do it a little bit more. You can also do this with both knees. So if you do it with both knees, I find that it works the joints of your back a little bit more, which can be a good or a bad thing depending on what sort of pain you're in. So you also want to be working your knees and your joints passively. So that is, you want your arms to move your knees, which will then move your back, rather than getting the muscles of your back to do the work, because then they will get tension going on in there, and what we're trying to do with the knee hug is to try and release the tension. So you get your knees and pull them towards you until you feel, again, around in this sort of area, a little bit of tension, a little bit of movement in those joints. And then if you feel a little bit of tension or pain, you just wait there, trying to relax and release that tension and possibly that pain. And then you can go a bit further or less far and try and work out where it is that you're feeling the most sensations and where you can get the most change happening. If that does help with your pain, then that's probably because the sensations you're getting are due to those muscles being really tight and really sensitive, rather than there being a problem with your joints in your back per se. If it doesn't help, it might be that the sensations you're getting are coming from somewhere else, and it's not necessarily those muscles that we're working on with the knee hugs that are giving you symptoms. But give it a try, see how it goes, see if it helps.